Good afternoon. I'm George Latimer, Westchester County Executive, and this is our weekly update on the Westchester coronavirus outbreak. We're here at the White Plains location of the County Department of Health at our local clinic, and I'm joined by Dr. Sherlita Amler, who's the commissioner of our Department of Health, and also by Lori Smittle, who's DPN. They're both going to be part of the conversation that we're going to have talking about not just COVID, but the flu season that we're entering here, as today is the first day of the month of October. We did not have our update earlier this week in respect to Yom Kippur, which was on Monday, and we thought that we would be wise to open it on the first day of October as we enter now the next month going through this pandemic. I'm going to first give some numbers. We're going to talk a little bit about the COVID issue and outbreak, and then we're going to shift gears, talk a little about the flu season, and then I'm going to get my annual flu shot, always reluctantly, but I'm being impressed by wiser heads that make me do what's right, which is what you should do too, and don't delay. But first, our COVID update. We do not have numbers as of this moment from the New York State tracker. So rather than having numbers today, I'm going to work off of yesterday's numbers, which were Wednesday, September 30th numbers that were made available to us. As of the 30th of September, we had 38,239 positive cases year to date on COVID. And the year really began in March, 1st of March, 2nd of March, when we had our first positive COVID case. Those positive cases from 2 weeks ago numbered 37,634. So when you look at the 2-week incubation period, if people who were tested positive 2 weeks ago have all cleared, and they might have fallen into a hospitalization or into, unfortunately, a fatality situation, that leaves us 605 cases of people who have tested positive within the last 2 weeks. Now, that number is a little bit higher than it's been at other times. We are testing a significant number of people these days, and I'm going to touch on how the most important statistic is not necessarily the active number of cases at 605. That's a significant number. It does not compare to the 12,000 active cases that we had during the height of the pandemic. What we do look at, I think very importantly, is the percentage of positive cases each day as a percentage of the total number of people tested. And during the testing that occurred, that was reported on yesterday, on Wednesday, we had here in Westchester County, make sure I get the correct number, and I'm not looking at a number from a different organization. We had almost 4,000 tests done that were reported on Wednesday, and we had 57 positive cases. That represents for that day 1.4% of infection rate. Now, we have been fortunate to have infection rates in Westchester County that hovered around 1% even, and on an individual day, that number could oscillate by a certain amount. So if we saw on a given day we were at 0.75%, we got as high as 1.5%, approaching 2%. Those numbers would be in the normal range given the number of people that we have. The prior day, we had 4,200 tests done on Tuesday. We had 44 positive cases. That was an infection rate of 1.04. So the difference from one day to the other is still within a certain range. And on Monday, there were 44 total testing, 35 positive cases on that date, a 1.19 infection rate. All those numbers are within a certain parameter. Now, you've heard people say there's an uptick in New York. And you have to break it down and look at it from a localized standpoint. There have been some parts of the Hudson Valley region that have had a more significant percentage. Rockland County, notably, in the last period of time, the period of time that we had a 1.4 on Wednesday, Rockland had 1,680 tests and 110 positive cases. And that meant that their infection rate for that day was 6.5. That's a significant number difference. Most of the rest of the area counties are very similar to ours. When we were at 1.4 on Wednesday, which was the highest of those 3 days, we were comparable to Nassau County, which also had a 1.4% infection rate. Suffolk was at 1.3. Brooklyn was at 1.8, Queens at 1.2, Orange County at 1.9, all within a relative range of where we were as Westchester County. This does not mean relax. This does not mean change your behavior. The masks are still necessary. The social distancing is necessary. Checking your temperature before you enter a public building is still a good activity. Washing your hands or sanitizing it, all of those things are still necessary. We are not out of the woods. And the fact that we don't have the spiraling numbers that we had in March and April is good, but it could turn around on any day for reasons that we would not necessarily know. What we have to look at as public policy officials, not public health officials, which is what Lori and Sherlita are, we have to look at what do we do to respond to the trend lines. And if the trend lines were to be more severe, then we would look at shutting down public access to things that would advance the spread if the spread is advancing. And some of those decisions are made by us. Most of them are made by Governor Cuomo using his executive authority. But we would look at our county parks as something within our control. Our county office buildings. Now, we could wait for gubernatorial executive order, or we could take action ourselves to deal with the county workforce. But those decisions we will make if the numbers show it. We're not going to do it just out of fear. We're not going to do it because we see something happening for a day or two or three. But if there's a legitimate trend line, then we will act, and we'll show that we're acting out of pragmatism, not out of any ideology. The wearing of the mask, I personally would prefer not to wear a mask, but that preference has no merit here. What it is about is when I wear the mask, I avoid someone in my proximity getting whatever it is that I might have. It reduces the likelihood of that happening, and that's what we're trying to do, is reduce the spread. I take great comfort from the fact that we had, about a month ago, an incident in Pleasantville where parishioners who went to a local Catholic church, attended Mass, were concerned that 2 of the priests tested positive. And then when testing was done on the people who had attended the various religious services, we didn't find another positive individual, which means that although the individuals who were serving Mass tested positive, they wore masks, they handled certain elements of the service appropriately. There was social distancing and hand sanitizing, and they didn't spread the disease. And that's really what we're striving for until the day comes when we get the vaccine, we get the antiviral treatment. And I say this every time, it is not for public official, a politician if you want to call us that, it's not for us to assert when the solution is going to come. Medical science will assert that. We've got some very brilliant people in the United States and everywhere else looking to find the vaccine, looking to find the antiviral treatment. But there is a scientific protocol that they have to go through. And we would be foolish to jump at every possible cure and every hint of a cure and build up expectations that are unrealistic. So we take it steady as we go. In Westchester County, every day, we look at the numbers. We try to determine what the numbers tell us. We try to respond to that intelligently. You do the right thing. I do the right thing as an individual, and we will get through this. That's the mission that's at hand. Now, I've mentioned a couple of statistics, the total number of cases, and I mentioned active cases and also the infection ratio of a day. We also look at how many people are hospitalized. That means how many people who have tested positive are so severely sick that they require advanced treatment in a medical facility. We have in Westchester County 3,000 hospital beds. We have 160 ICU beds, which are used for more severe cases. When you hear about people going on a ventilator, that would be in an ICU context. We have right now, as most recently as of Tuesday, 27 people with COVID that are hospitalized. There may be other people who have it, but they haven't reached a point of severity of illness where their doctor has encouraged them or they themselves have hospitalized. So as a percentage, to have 27 out of 605 people that we know of as positive, there's probably a number of people that are positive that haven't been tested that we don't know about, but to have 27 hospitalized is a good fact, and that number has been relatively stable over the last 2 to 3 weeks. We have ranged in the 30 and then dropping down into the 20s. If that number starts to jump up, excuse me, that would be an indicator of something serious happening, and then we as public officials would have to respond to that. But at 27, and it's been very similar the last few days before that, we were very good. Just to give you an idea of metric, this is the first day of the month of October. On the first day of the month of August, 2 months ago today, we had 44 people hospitalized because of COVID. So it's not a straight mathematical projection. We didn't go from 44 straight down to 27. We had our ups and our downs. But as a rough idea, 2 months ago, we had almost half as many more hospitalized as the ones that we have now. And then the ultimate example of the failure to protect human life is in those fatalities that we have. We have, as of the most recent report, 1,456 fatalities year to date. The vast majority of those fatalities happened within the first 2 months of the outbreak. We saw a tremendous number by late March and throughout the month of April, and it continued a bit through May. But to give you a parameter of how we were, 2 months ago today, we had 1,445 fatalities, meaning we've lost 11 people in 2 months. And we had nights where we lost a multiple of 11. And so to have lost as few as 11 people over 2 months is good news. Now, I don't want to be insensitive. The 11 people that died were important to somebody. Somebody loved them. They were somebody's parent or son or relative or friend, and we mourn those individuals. And that's why we set up months ago the Ribbons of Remembrance down in Lenoir Preserve in Yonkers. So a place for you to go where you can physically write out a message and tie it to one of the trees and mourn. We need to have that as human beings, certain ways to express how we feel and to have the proper respect for those that we've lost. But we do look favorably on the fact that the number of fatalities have dropped down dramatically. There was a point in time, Dr. Amler was very much a part of this, along with our Director of Operations, Joan McDonald, where we had a fatalities management crisis in Westchester County. We could not handle the number of people that were dying per night in a civilian context. We could not preserve them for proper burial or proper cremation. And that was how bad it was at the worst. And that's what we never want to come back to. So if today our restaurants are open and they can stay open, if our offices are open and they can stay open, if we can have some modified sports that are going on out there, we keep most of our park system open, but not all of it. We're doing it with a mind to have people express the natural desire to interact in the society and because we need the economic growth. But we cannot go back to nights where we had 55 and 65 and 70 people dying. We cannot do that. And so we'll have to shape our policies around whatever the numbers tell us. As of today, the most recent number, 27 people hospitalized, no fatalities over the last 6 days, 11 fatalities over the last 2 months, 605 active cases, and we hope that those numbers will continue to show a positive direction. We do not have a cure for this disease, so therefore we expect that more people will be infected, but if they can get the right medical help, they can recover, and we can go forward. And in due time, we hope we'll be back to the society that we remember that we had back on March 1st, or February 29th, to be more specific. Now, we're here today in this location, so that I can get a flu shot, which I've tried to avoid, as I usually do. Lori knows. But prudent people get their flu shot, and they get them early, so I'm going to try to be prudent this year. It's important to differentiate, and I'm going to let Dr. Amler, and I guess I should say Dr. Smittle as well, she's a doctor of nursing, to explain why a flu shot is important. But from a practical standpoint, and I've never been shy to note that my age, I'm in my late 60s, that to avoid getting the flu is extremely desirable in the age of COVID. You do not want to have the flu and COVID at the same time. And if the flu shot can reduce, it will never fully eliminate, but if it can reduce the likelihood of you getting the flu, then you should get a flu shot. And they'll speak to the nature of the flu shot and so forth. The flu shot does not cure COVID. Anybody who misinterprets that, anybody who sees the video of me getting a shot and says, oh, he got a shot for COVID, you would be misinterpreting the photograph. The photograph is the shot necessary to reduce the likelihood of my getting the flu. It's possible I might get the flu. That also requires me to do prudent things in my life as well. But the bottom line is there is a nexus now because now we are entering flu season and we're still in the age of COVID. So with that, I'm going to ask Dr. Sherlita Amler, who is our terrific Commissioner of Public Health, Commissioner of Health. She's done a marvelous job keeping us on the straight and narrow. I can't speak for other executives at other level of governments, but I rely on her advice, and I know that she consults with her colleagues out in the field to try to come up with the best possible advice, and we do our very best to try to make the decisions as public policy officials based on public health officials. Dr. Amler.
So as we do every year at this time, we have this conversation around influenza. But I think it's even more important this year than in previous years because, as the county executive said, what we're trying to avoid is a couple of things. One, diagnostic confusion. So the flu, influenza, and COVID have very similar symptoms. You could have a sore throat, a cough, a fever, just general malaise. And it would be very difficult for you or your physician to know, are you coming down with a flu or are you coming down with COVID? And the difference in how this is managed is tremendous. Not to mention, it has implications as to whether or not we quarantine or your contacts and isolate you. So by getting a flu shot, you kind of take influenza out of the picture pretty much. And then your physician or your healthcare provider will put a more emphasis on the fact that this might be COVID and not just the run-of-the-mill flu. And that could be very important to your health. So we want to not have diagnostic confusion. Second thing, as the county executive said, it is possible a person could have both of these infections. People die of influenza, people die of COVID. Somehow it doesn't seem like it'd be a good idea to have both of these infections at the same time. So it's something we would try to avoid. So some of the common misconceptions that I go over almost every year, but I think they bear repeating, is that you cannot get influenza. You cannot get flu from the flu shot. The vaccine is a killed vaccine, and so it is not possible to get it from the actual shot. That being said, if you were exposed to influenza and you are incubating influenza, the vaccine will not prevent you from going on to have symptoms. If you got it early enough in that process, it might result in maybe a lighter case of influenza. We can't be certain on that, but it will not prevent it. So again, the vaccine you cannot get influenza from getting a flu shot. Some of the other misconceptions I think that people commonly have around influenza is that getting the vaccine in October is too early and that it'll wear off and that I'll have to get it again or I might not work when I need it. October is certainly not too late to get an influenza shot, and it would not mean that you require another one. One vaccine for the season protects you for the whole season. So we would really encourage individuals to go out and get your vaccine. Luckily, not only can you get your vaccine now from your physician, you can also get the vaccine at many local pharmacies. So there's really a wide range of locations where people can get a flu shot, and we would encourage you to seek out all of those. Not the least of which is the vaccination clinics that we, the health department, run. And we just had several flu clinics yesterday, and I'm going to give Lori a brief moment to talk about the clinics that we have run, and we'll talk a little bit more about influenza. Lori?
Hi, good afternoon. My name is Lori Smittle. I'm one of the nursing supervisors for clinic operations here at the health department, and would just like to echo what Dr. Amler and our county executive has already said about underscoring the importance of vaccination, especially during a pandemic. The reason we promote the flu vaccine is to protect ourselves and to protect those around us. So if for any other reason at this time, it's crucial that everybody think about how they can best protect themselves and their loved ones, and please consider vaccination. We are very proud here at the health department. We're able to offer vaccine here at our clinic. Information will be on our website. We've been out in the community. We vaccinated hundreds of people yesterday in one day. The nurses here are expert at immunizations, and we just want to encourage anyone who's looking for a place to obtain a flu vaccine to please consider us as an alternative, because it's just that important. Thank you.
So the county has actually purchased 20,000 doses of influenza vaccine that we will be giving out for free. And some of the places that we will be going to will be, in addition to the clinics that we have here, we will be going to some of the food pantries, some of the homeless shelters. So we'll just, if you, as Lori said, if you will check our website, all of that information will be up there shortly. We're just trying to finalize some of the details. The other thing I'd like to talk about is children, and how are children impacted by influenza, and how do they play into this whole situation. A lot of people feel that vaccinating their children for influenza is not necessary. They may get a flu shot, but they think children don't really need to be vaccinated for influenza, and unfortunately that's not true. Every year we have 100 or more children in this country who are perfectly healthy, normal children who become infected with influenza and die. In addition to having the possibility of a bad outcome from influenza, children can act to spread this disease. So we know that people over 65 are at increased risk for COVID and the complications of this disease, but they are also at risk for the complications of influenza. So if you are going to take your children around their grandparents or other people who are older, it's a really good idea that you have them vaccinated so that they don't act to spread the disease to people that might have a really bad outcome. So get your children vaccinated. You can do that if they're older than 6 months of age. They can take a flu shot. For people who are adverse to needles, there is also an influenza vaccine that is a nasal preparation that's just sprayed in the nose. You have to be over 2 years of age and under 50 to get that preparation of the vaccine. And there are some people with certain medical conditions for which that form of vaccine cannot be used. But I would encourage you to have this conversation with your doctor. I don't really care where you get vaccinated. The key is just get vaccinated. That's the most important thing you can do to protect you, your loved ones, everyone you care about. Hopefully at some point soon, I'll be standing in front of this podium saying we have a COVID vaccine, and that will be a happy day for us. And so until that day, I don't have a vaccine for COVID, but I do have a vaccine for flu. I highly encourage you to take the opportunity to use this vaccine to protect your health. And so I think, County Executive, we're back to you.
Thank you. Thank you very much, both Sherlita and Lori, for adding your professional insight into this. I'm going to make a general comment, then we'll go to questions from the press. Then I'm going to sit down and get my flu shot. In serving as county executive for almost 3 years, the county is involved with a host of different areas of public service. And I sort of liken it to what happens, for any of us who may be homeowners and the things you have to do around the house. I'm certainly capable of taking out the garbage. I'm certainly capable of cutting the grass. If I don't have the time to do it, I can hire somebody to come and do lawnscaping. They'll do it better than I can, but I can do it adequately enough well. When we get into electrical work, I can, do very basic things, but if I'm going to do something elaborate, I get a professional to come in who really understands electricity. The same thing would be true of plumbing. You make the decision as a practical person when you look at the problem in your house and you ask yourself, can you actually handle it? Or if you don't think you can handle it, do I need to bring in a professional who will help do the job that's necessary to do? And you know that if you make a mistake with electricity, you could pay for it with your life. You could make a mistake with plumbing, and you might cost yourself thousands of dollars for a leak that doesn't get fixed and a problem that exists gets worse. If you want to go on the roof of your house and do work yourself, if you have that skill set, that's great. But for the vast majority of us, we don't have that skill set. And I view that same parameter as I serve as your county executive. I look at the different departments of county government, and every one of them has a certain amount of expertise and professionalism that goes into that work. We have some departments that people from the outside looking in think, how hard could it be to run a parks department? Some folks might say that some of these things are easier than other things. But I think we have to understand that we're in the area of medicine. We have two departments that focus on science and medicine, Department of Health and Department of Labs and Research. The vast majority of us would be in over our heads as laymen to try to make decisions that involve what would happen in the matter of public health. Because there are almost 1 million people that live in Westchester County. And if you make the decision casually and you make the wrong decision, people could die. And so you must take your time, in my judgment, and you must consult with people who have greater experience and expertise than you do. None of us are perfect. The medical doctors don't always agree. The way that each person administers their portion of this area of public policy may not be the same as somebody does it in another area. But this is no time to think you know something or to consult Dr. Google and let Dr. Google tell you what you think is right. You will find 1,000 different advices out there on the internet, and they will conflict with each other, leaving you to draw the judgment yourself. And I personally draw the judgment that I'm going to lean on those professionals in medical science. Now, I know this could be a controversial issue. The issue of vaccination is a controversial issue. I've had people visit with me during my years in the state legislature who are convinced that the opposite point of view exists. And this is a free country, and you have every right to advocate for your point of view and to believe the things you want to view. But in running a government, not just taking a position on a public policy issue, I have to err on the side of what appears to be the consensus, and the medical consensus to do certain things is very important to me. If I get this wrong in the policy and people die, that's on my head. And you don't have to be in office to still feel the guilt years to come for decisions that you made casually, or you made for political reasons. You made because it would be easier to say this rather than that. It would be easy to say this thing will go away. Well, if it doesn't go away, and what happens, and the numbers that I just read to you today were not as good and were much worse. And then you'd look in the mirror in the morning and you'd say to yourself, why didn't you listen to good advice? We run sewer treatment plants. I don't know how to run a sewer treatment plant. I don't make it a point to override the people who run the sewer treatment plants and tell them, from my layman's experience, how to run the sewer treatment plant. And that's what you have to decide as an individual. You have to decide, what decisions are you going to make in your life? What decisions are you going to make for the children in your home? What decisions are you going to make for your aged parents that seem to be the most prudent? It's your decision. We're free Americans. But I also think that at moments like this, we should be sober about it. We shouldn't do it out of ideology. We shouldn't do it out of prejudicial thought. We should make sure we've studied the issue properly. We listen to the right voices. And with that thought in mind, I'm going to get a vaccination that I hope will help me. And we'll see how it all works out. Nothing is ever guaranteed in this world. But I think it's important to understand that for those of us who are making public policy, for a lot of people, and for you that are making decisions for your families, you got to try to get it right.
So do we have questions?
Oh, I'm sorry. Yes. Before I get, I'm so ready to get that shot. We'll go, not really. Let's go to the press.
So we have one question from Mark, Channel 4. He asks, New Rochelle sent out a warning email about the rise in COVID cases. We're seeing an uptick in the county. What's your message to residents?
Well, I think, and to the extent that I sort of said this earlier, I'll in essence repeat it. We're looking at a number of different variables that, when taken together, give us a picture. There are certain of those numbers that are more concerning, to be sure. If you look just at the number of new positives and you aggregate them over 2 weeks, they are a higher number today than they were a month ago or 2 weeks ago. That's the number of active cases. And certainly every community has some portion of that 605 cases. There are communities like Poundridge and Buchanan, based on population and low population, lack of density, that show almost no increase. Urban centers like New Rochelle and Yonkers, with the highest population in the county, usually do lead the list in absolute numbers of cases. What we see as a trend, an uptick, can't be judged by one number or even two numbers, and I think I laid out what my sense is. If we see more positive tests because we're testing more people, and if we see the percentage of infection on any given day, you test 10 people, one person has the disease, that's 10%. You test 100 people and 10 people have the disease, that's also the same percentage. But the impact of the absolute number is greater and may make you draw the wrong conclusion. So we look at all of those numbers, and I do think the numbers on hospitalizations and on fatalities are at a stable level that tell us that what we're looking for, we should keep looking, keep analyzing it, but they do not yet tell us that we are in a crisis situation as we were before. Each community communicates, each mayor, each supervisor communicates to their community. I know they're all trying, as we are, the very best to get it right in their jurisdiction. And it might be in Community A, there's one message, and Community B is a bit different message because of the geographic distribution of these things. But as I've looked at the numbers right now, we're watching. We're always concerned. We see certain numbers that may be a little more robust, but it is not yet a trend of an uptick in Westchester County. Please do.
So, as you've heard us say many times, and I will repeat this, if there is no exposure, there is no risk of disease. So we know that wearing a mask, social distancing, really does work. And I mean, we're proof of it. The numbers that the county executive has read off to you show that we know that this works. So people need to keep this in mind. Now, as I've said before, now is not the time to decide that you're going to have a party at your home for 100 people. Now is not the time to decide that you're going to go, let's say, you're going to go to the mall and you're going to spend a whole day there and you're not going to wear a mask, or you're going to, be in a car with 6 other people and not wear your mask, and you're going to be in the car for a long extended period of time. The risk to COVID is not just that you are in a room with somebody who has COVID, but how long are you in that room? How close are you together? And are you wearing a mask? And you can prevent yourself from becoming infected by just doing the things that we've talked about all along. It's not a magic bullet. It's just that we know that these things really do reduce the risk. So wear your mask when you're outside. Keep social distancing. And if you know that you may, in a large group, limit the amount of time that you are spending in that group. And that will go a long way to preventing you from having that exposure. And again, with no exposure, there is no risk.
Any other questions? Okay, very good. If any of our friends who are observing this can reach out to Catherine Chaffee if there are questions that come up subsequently, by all means, we'll do our very best to answer them. We're scheduled to do our next official COVID update on Monday, and we'll give you the numbers there. We'll see what kind of trend lines have developed since then, and we'll try to draw some observations. I apologize if some of these things seem repetitious. We never know who's watching this for the first time and who may be seeing this on a regular basis. But we will try to give you the information as we know it and try to give it to you as honestly as we can. When we discuss on Monday, we'll talk a little bit more about some of the other initiatives on the economic development front that relate to COVID outbreak, some of the other programs. But for today, we're dealing with the infectiousness of COVID and the flu. So you're in charge.
There's also a new app.
You want to get to the microphone?
Karen, why don't you come up? So there's also a new app that you can put on your phone that will actually tell you if you are within 6 feet of somebody who is COVID positive. And I'm going to let Karen Hopfinger talk about that.
Hi, okay, this is a new app that New York State has rolled out, and people who are doing contact tracing and calling people who test positive will be asking them if they are familiar with this app. You can download it for basically all kinds of phones, and it's the COVID Alert New York app. It's free, and by downloading it and clicking that you agree, so wherever your phone is, usually it's with you, it will then collect information from other phones that have the app, and if you or a person that you were with tests positive for COVID, it will send the information about whoever tested positive to the other person's phone and to contact tracers. It's and it's anonymous, so you won't know who the person was that you were with, that you were near, but it allows contact tracers to do their job and to notify people potentially a lot faster if people agree to the app. And again, it's anonymous, so no private information is being shared.
The app is
It's called the COVID Alert NY. And
COVID Alert NY.
it's available on free on both platforms.
Thank you.
Thanks.
Good. Thank you, Karen.
All right.
Take my jacket off, I guess.
Yeah, they're kind of sticky when you put the hand sanitizer on there. It makes your fingers stick to the glass. And it also makes my mask fog up. So getting a reprieve for a few minutes here while I get my gloves on. Okay, so let's.
My communications team seems to be particularly amused by this. I feel like the little kid in the back seat of a car on a long-distance trip. Are we there yet? Not yet. Not yet, George. Great, thank you.
Well done.
Thank you. So easy, I'll have another. Thank you very much. Yeah, go close out. Thank you all for watching. You're the proof that I actually did get my flu shot. And we hope you'll do the same thing. It was as easy as pie. And you have that sense of feeling that you're protected as you go forward, but you still have to be smart in the way you live your life. Thank you very much for watching. Thank you both to Dr. Amler and to Dr. Smittle for being with us here, Karen Halfinger, Catherine Chaffee, the members of my communications team, and to our friends here in the Department of Health for hosting us here. And I assume sometime next year, God willing, I'll be back to do this again. Thank you very much. Have a good afternoon and be safe.